I'm Dr. Anthony Maloof of Eyes and Faces and Cornea and Ocular Plastic Surgery in Sydney, and welcome to this video on watery or dry eye, the one-step real-world test. People come in, they're referred in, they come in and say they've got dry eye or whatever, but quite often they've got watery eye and they can't tell the difference. They'll often tell me they've had funny tests done, certain machines that do tests, or something called a Schirmer's test where a strip is put in the eye and said my Schirmer's test was low. But all these things are artificial and they change the environment. So what I've worked out over the years is there's a very simple one-step real-world test that minimally changes the environment that tells me straight away whether you've got watery eye or dry eye. It costs nothing, it doesn't hurt, it doesn't take much time, and it's almost 100% effective. And I say that reliable. When I say almost 100%, nothing's 100% in life, but it works every single time. So what is it? Well, firstly, you produce tears. Tears are produced in the tear gland on the outside of the eye. They drain across into a drain pipe. If you produce too much tears, then you have increased volume of tears in the front of the eye. If you don't produce enough tears, then you have reduced volume. That's the first concept, volume of tears. The second concept is how quickly do those tears turn over? So there's turnover time and there's volume, and you can check both with one simple test. That simple test relies on something called the fluorescein strip with a little bit of salt water. I coat the tip of that fluorescein strip with salt water, shake off any excess, and gently place it on the inside of the eye. And it stains the tears and shows me the surface of the eye. So here's how to do it, and here's what we look for. When you do that, it takes about 5 minutes. And in that 5 minutes, the most important thing you see is, have you got too much tears or too little tears? If you've got too much, you've got a watery eye, which means a tear drain blockage. If you've got very little, that means you don't have a blockage. And now the question is, how long does it take to clear? The tear should clear in 5 minutes. So here's the golden bit. If after 5 minutes you've got too much and it hasn't cleared, you've got watery eye and you've got a tear duct blockage. If after 5 minutes you've got really little, but it hangs around 5 minutes, 10 minutes, 15 minutes, you've got a dry eye. You're not producing enough tears to flush out the fluorescein. It's that simple, it's that effective, it's that reliable that I can almost diagnose the type of obstruction based on the result of that test. So I hope that all makes sense. How to differentiate watery eye and dry eye with one simple, clear, effective test in the real world. I'm Dr. Anthony Maloof of Eyes and Faces and Cornea and Ocular Plastic Surgery in Sydney, and thanks for watching.